Seizure and epilepsy are words that usually go hand in hand. If someone is convulsing, it's easy to assume he or she must have epilepsy. But there's another type of seizure called non epileptic, and telling the two apart is proving to be a challenging task for neurologists because oftentimes the two can look identical.
Well, the key difference is that epileptic seizures are caused by abnormal electrical activity in the brain, whereas this activity is not found in non-epileptic seizures.
Dr. Marcus Roiber says non epileptic seizures are often caused by a psychiatric issue, and some people have both epileptic and non epileptic seizures. Not identifying the difference is leading to the wrong diagnosis and treatment. A big danger is seizure medications.
What you're trying to do is stop the epileptic discharges.
But with no seizure activity to stop, the drug instead works like a sedative.
It can lead to people being intubated on intensive care units because they've been given so much medication they stop breathing.
The other crucial reason for getting the right diagnosis is to help people without epilepsy understand why they would convulse, stare, or do other unusual behaviors. Many medical professionals use the term psychogenic non-epileptic seizures because the root cause is considered psychiatric.
That is a complicated term. Patients often find it upsetting or weird because to them the problem feels physical.
Epilepsy is caused by a number of things, including physical trauma that leaves permanent damage to the brain. But it's psychological trauma, which often leaves an emotional scar that can lead to non-epileptic seizures.
A history of trauma, especially sexual trauma.
In a traumatic, stressful situation, Dr. Roiber says people don't form memories in a normal way.
So often they end up with bits of memories that can be quite disjointed. The carpet, the color red, a smell.
When a person experiences this trauma, a seizure is the body's way of expressing what the mind cannot.
It's like the seizure happens instead of the panic attack.
The person, in a way, has an altered state of consciousness and is in distress.
Dr. Rosa Michaelis is a neurologist at Herdecke, a hospital in Germany, and she has a special interest in non-epileptic seizures. She and Dr. Roiber are part of the International League Against Epilepsy's Psychology Task Force. Roiber says some people with non-epileptic seizures don't lose awareness of their surroundings, although others often do.
That is one of the factors, actually, that is causing people to think of non-epileptic seizures as faked because they can't get their head around an unconscious process that can somehow leave you in a state where you can still respond to your environment.
Non-epileptic seizures are most commonly diagnosed between the ages of 15 to 35, and 2/3 to 3/4 of patients are female. Dr. Michaelis says non-epileptic seizures require psychiatric help. That makes it ever more important for people with uncontrollable seizures to see an epilepsy specialist with expertise in EEG. If epilepsy is ruled out, she says a referral to a psychiatrist should be the next step.
It's actually crucial that the person explaining the model to them accepts that it is psychological, but it is unconscious.
With the right treatment, Roiber says patients can overcome these non-epileptic seizures. He sees the success stories in his hospital.
We've got evidence that about 50% of patients will become seizure-free in the long term, and more importantly, about 90% get significantly better.